Another dilemma that I'm going to pose for y'all is the good old informed consent dilemma. The scenario goes, a patient is admitted to the hospital with a life-threatening condition and urgent surgery is recommended. However, the patient is in a state of confusion and is unable to provide informed consent. The patient's family is unavailable, and the medical team must make a rapid decision. How can the nurse ensure the patient's best interests are served while acting in the patient's best interest under emergent circumstances? So this one is really, really tough, and I'm glad the ER is posed with making that call oftentimes versus the ICU, because if you go along with the surgery, you get sued. If you don't go along with the surgery and the patient dies, you get sued. So this becomes very, very murky waters, but in healthcare, and I believe in law, I have to do a little bit more research on this, but there's the Good Samaritan law. But I'm pretty sure that Good Samaritan law is about people that maybe are down in the environment, not necessarily in a hospital, but ethically wise and morally wise, personally, I'd have to say go with the surgery. If the patient is about to die and you don't perform surgery, I'd have to go with do the surgery, because if you don't do anything now, they're going to die regardless. But if you do the surgery, yeah, they might die in surgery, but they also might survive. So this one's very difficult, but if family cannot be reached, I would try to put it off as long as possible. And if it's just either now or never kind of situation, I would say just go with the surgery, because this gives the patient technically the highest chance of survival, so they can make their future decision. I don't think people or hospitals could get sued for that kind of stuff, but you never know, unless for some reason somebody missed their advanced directives. Maybe they haven't looked in the system properly, but hospitals usually have those documentations fairly handy, especially if that patient has been in the hospital before. But for this one, I'd say ethically and morally, I would have to decide to give this patient surgery.